Have you ever had that burning in your upper abdomen or in your chest or in the back of your throat? Hi, I'm Dr. Peters with Peters Wellness Chiropractic Massage. In this week's quick video, I would like to discuss how to prevent heartburn naturally. Now, some of you might say, man, I don't have any heartburn. Well, if you don't have it or have never suffered from it, consider yourself lucky because you probably know quite a few people who have. And as a matter of fact, the journal Lancet found that 1 in 4 people in Western countries suffer from heartburn at least once per month, at least one time per month. And we know that frequent heartburn is a potential symptom of GERD or gastroesophageal reflux disease. And making sure that it could be something else too. It could be like a hiatal hernia. There could be a few things that could cause it. And, a lot of us would think immediately of dietary issues or stress-related issues as possible culprits. So what exactly is heartburn? So if you think of the esophagus, so like this line on my shirt, right? So we've got the esophagus, which is when you eat something, you're swallowing food. And the upper part is called the upper esophageal sphincter. Now, the upper esophageal sphincter is controlled by you. Like if you're going to burp or swallow or hold your breath, do things like that, you can control that with your nervous system by thinking about it and making it happen. The lower esophageal sphincter, that is controlled autonomically, meaning you can't think about making it be controlled by you. So it's just going to happen naturally. And sometimes these things don't happen, either because of some type of dietary or drug-related response, or it could be because of some type of neurological issue happening, which, sometimes chiropractic coming into effect and making sure all the joints of your spine are working properly. So first, I'd like to discuss diet and stress-related issues. And thinking about there are specific foods they found to cause issues. So I just want to list those real quick. And again, most of us probably know this, but I might mention something that could make a difference for you. Or maybe when you're out with friends and somebody's eating terribly and you're looking and they're having heartburn later, you're like, well, you did have some fried food and you pushed it down with a glass of wine or alcohol. And then for dessert, we had chocolate. And then you had a little peppermint on the way out. And I think one of your main meals had garlic and onions on it. And then you had some tomatoes with that mixed in there. And then we had an espresso and smoked a cigarette after. Oh my God. That is just totally set up for heartburn because fried foods, alcohol, chocolate, peppermint, garlic, onion, tomatoes, caffeine, and nicotine are some of the things that we know that can cause more issues. Some of you might say, well, what else is there to eat or drink? But there are other things. And that is just something, if you suffer from this, these are the things you want to be cautious with. And a lot of people will turn to antacids as a way to control or help with the heartburn. And again, if you need to rely on something once in a while because you went out and had a big Italian meal and chase it down with an espresso afterwards, those things are available. But if you're having this on a regular basis, it is a sign and you should take it maybe a little more seriously because there could be some other underlying conditions. Things like Rolaids, Tums, Maalox. When I was a kid, when I was a teenager, I still remember this little wrap. They were like lifesavers, except they were Rolaids, and I carried around in my pocket because I needed to take them like 2 or 3 times a day. High stress and not a very good diet. My mom used to make delicious cookies, and I had too much sugar, too much stuff that irritated my system. And I turned to having these things. And getting adjusted more helped me in changing my diet because my doctor would say, you need to clean up your diet. So I cleaned up my diet and I rarely will have an issue now. I don't even remember the last time I had heartburn. So stress and a bad diet can definitely lead to some esophageal issues or GERD and things like that. Also, another thing people might do, if the Rolaids or the Tums and the Maalox isn't working, they might take it a step further and go into things, and I've written these down here, Tagamet HB, Pepsid AC, and Zantac 75. Now, these are all H2 receptor blockers, so that means they basically block it so your cells in your stomach don't have as much acid available to have this effect. So the other side of it is a drug called Prilosec and Nexium, and those are actually proton pump inhibitors that inhibit the making of the acid for your body. Now, the reason why this is bad, and I've listed a couple of things here, and this week's Optimal Health University goes into much more detail, but in the Journal of American Medical Association, or JAMA is the name of it, Journal of American Medical Association, found that reduction of gastric acid secretion by acid suppressive therapy allows pathogen colonization from the upper gastrointestinal tract. The study concludes current use of gastric acid suppressive therapy, which is the things we just talked about, was associated with increased risk of community-acquired pneumonia. So think of it, taking the antacids and these suppressive things for the acid are causing people to have more pneumonia because you need the stomach acids. The only problem is you need the acids to stay in your stomach and not get up in the esophagus. So if that sphincter isn't closing properly, it can get up into there. They do mention a few things, natural things. If you are controlling your diet and you're looking at what could be some possible causes, they also talk about literally putting blocks under the headboard of your bed and bringing it up 6 inches. And the reason why is that way when you sleep, your esophagus is going to be slightly elevated above your stomach. This, I think, would be for someone who is suffering to a high degree. Now, we know that you shouldn't eat, well, if you suffer from this, you shouldn't eat 3 to 4 hours before bedtime. Diet-wise and workout-wise and stuff, that could be argued. But right now we're talking about if you suffer from this and you're waiting to figure out what's going on and get it under control, this would be a way to elevate the headboard or the head of the bed so that you're elevated. You want to be really careful, laying on pillows. They do make wedges for that too. But just be careful you don't tweak yourself and now you got low back pain, neck and shoulder pain. But if you do, come in and see me and we can help you with that. The other thing I wanted to talk about is be aware of medication. So there is a list here in this week's Optimal Health University that lists some of the medications that may spark heartburn. So I'm just going to go through the list. Aspirin, NSAIDs or non-steroidal anti-inflammatory drugs, narcotic pain relievers, antihistamines, asthma medications, antibiotics, heart medications, anti-anxiety medications, osteoporosis medications, steroids, chemotherapy drugs. And there is just so much that we can do for other things that can have secondary issues. Sometimes it can cause problems that are worse than the original problem that you were dealing with. So I just want to look real quick. So the other thing what I want to talk about as far as something you could add to your diet that's a natural good thing that we need that can help with this is adding more fiber. Okay, so adding more fiber can help. We carry a Nutrigen product in our office that I keep up front. And what I like about it, sometimes when you mention fiber, people are, they don't want to do that. Well, this fiber, it's in a white powder. You can either add it to a smoothie, you can just mix it with, whatever drinks that you have, and you can get this into your body, increase your fiber. If I remember correctly, I think you're supposed to have 30 to 35 grams of fiber a day. I try to go beyond that because the fiber can help with the digestion, of course, and just help make you feel better. And it also helps fill you up. So that, because the other thing mentioned in the article this week is even just a few extra pounds on you can lead to some of these issues we're talking about with the heartburn. So that's this week's video. I hope you find some value in this because Suffering with heartburn can lead to other issues, and it's a sign and a symptom. Remember, I entitled my book, Pain is Fantastic. You're like, who would say that? Because pain itself is not fantastic. It's not fun being in it. But pain as a messenger to let you know something is wrong, listen to your body. Don't ignore it. And don't dumb it down with a bunch of drugs that could make matters worse. So have a great week. And if you know somebody who's suffering, share this message with them. Let them know. Show them this week's Optimal Health University so that they can get help and help this be something that is not affecting their lives in a negative manner.